Assalamualaikum and hi, good evening. My name is Faezah, Binti. So today, before that, this is my patient, Encik Fahmi. Encik Fahmi, thank you for volunteer. So anyway, I just want to let you know that this video will be shared with lecturers and also some of my colleagues. So I hope you give a permission. Okay, thank you. So we're going to proceed because today we have two questions actually, case 1 and case 2. We're going to run the case 1 first. For this case 1, is actually 22 years old boy who's actually having right shoulder pain, so mostly at the lateral shoulder. Okay, so now he's complaining of having difficulties in lifting up 5 kg of dumbbell or weight, and also unable to do overhead movement like swimming, so backward, and also complaining of having morning and late evening pain at the lateral shoulder. So today we're going to run an assessment just to see on some motor control movement, and from the assessment we can actually progress, prescribe what kind of treatment for this patient. Okay, just standing. Okay, any assessment we're going to start with observation anterior. So you can from here you can see at the clavicle level. Okay, and also we can see whether there is any compensation because of pain, upper trapezius muscle overactivity. And from lateral side we can also see if normally patient who's having pain, there will be some protected movement, like this patient slightly shoulder protected movement. And also we can see from back where we can see at the scapular position in normal standing position without any movement yet. So from here we can see the right shoulder is slightly, we call it, you can see the level, it is slightly protected because of protected movement of the shoulder. There's a gap. We normally have a normal gap will be like 4 fingers, and here you can see the inferior angle of the scapula slightly tilted. Okay, might be due to some weakness of the could be weakness of the serratus anterior muscles. Okay. Okay, now we will proceed with, can you just move front 3 times? I'm going to ask patient to do 3 times frontal, side, and then just to see on the quality of movement. Okay, let's move 3 times. Okay, from here you can see patient there's some composition in movement, whereby one is trying hard to lift up because is it pain? Okay, because this patient is complaining of having like 5 out of 10. So you never mind, you just move up to where you can go only. Okay, and then try to side. Okay, from here you can see when he try to move, you can just do. There's a composition and also the neck movement because he was trying to lift up the shoulder at the same time. Because of difficulties and pain, there's some neck movement involved. And back. So, from back, okay, now move. So you can see there is difficulties in moving the hand behind to move at the extension because of pain, and also like protected, there's a restriction there, and also there's a composition. One more time. There's a composition of the neck and also upper trapezius overactivation, just to make sure that he can actually move further. That's why there is a composition of the muscle. So when we do the assessment, we need to look at static, some before we start with dynamic. For today, our main task is to do hand behind shoulder, hand behind back. That's why before we do that, I'll just do some movement so that we know that hand behind back is actually a combination movement. Not many patients can do that, so that we start with some activities or movement that is actually one plane. Okay, now we're going to do like this movement. I know you have having pain, but you just move to where you can only. Okay, now try move. Okay, slowly. Okay, now move. Okay. Okay, I'm going to ask patient to do 3 times. Okay. Can do 2 more times? Okay. Okay. From here we can see few impairment or limitation in, because of one main problem is pain. The pain cause patient to be like a bit on protection, where you can see the shoulder keep on protecting at the same time when moving, and also again the neck movement involve upper trapezius overactivation, and also you can see the, because of trying to move further and the neck control, deep flexor muscle involved, and also there's a weakness at the deep flexor muscles. Okay, one more time. Okay. So yeah. So here you can see a bit wingy, and also you can see some rhomboid muscle and also stratus anterior weakness. And because of protected movement, there is some tilted anterior tilted of the right scapula. So these are the things that we are looking into. One is pain, especially pain is because pain will actually inhibit a good movement control. So for this patient, I assume he is having pain 5 out of 10, which there is a limitation in doing this assessment, but we can try and do it to patient, ask him to do to where we can. Okay, this is we finish on this first case. So we move on to the second case. For this second case, this is a 23 years old boy who is actually complaining of having intermittent knee pain at posterior knee. It was actually intermittent, was 1 out of 10, but his main problem is problem when doing kicking for repetitive kicking. That's only the main problem. So for today, before we do that, we probably need to, before we test, the first test we're going to do is, okay, we are going to ask this patient to push the knee down. Okay. Okay, okay. This is the injured leg. Okay, okay. Try to do this thing. Can you just do 3 times here and 3 times there? Okay, yeah. Okay, one more time. Just on the left. What we can see here is when he tried to push the knee down on the right knee, the injured leg, there is composition, there is a patient is actually having a bit difficulties when pressing the knee down, and also there is a composition of the trunk movement because weakness of the quadricep muscle, especially the VMO muscle that works at the end range of the knee extension, and also there's a difference in from right to left. Better. There's a better control, better. So now we're going to test in sitting. Okay, you are going to do in sitting, you just move. Okay, from sitting and then just move. Okay, maybe we do on the good leg first. Okay, 3 times. Okay. Okay, alright, good. The right. There is a few differences from left to right knee. Okay, what we can see is again there is he is actually unable to control the trunk. There is a composition of the trunk muscle because of weakness of the quadricep muscle. For him to extend the knee, there is a weakness. That's why he actually compensate with in order for him to push the knee further. Okay, that shows a weakness of knee, especially and at the VMO muscle. Try to extend again, and also there is slightly rotation of the hip level knee, which shows some weakness at the VMO muscle. Trying to get the full knee extension with composition of rotational movement. Okay, so can you see the difference? Okay, one more thing we can see is also in bridging. Okay. Okay. For his problem, I think bridging we can also test the bridging because for kicking he need a good from extension movement for kicking. So we can also test whether for this kicking movement is there any limitation or weaknesses at the gluteus muscle. Ready to try? Lift up. Alright. You can just dig it 3 times. You can see, okay, he was actually unable to lift up higher. It should be same level at knee and also hip. So this is normally the normal range that he's supposed to reach. Try to go higher. And also you can see the left can lift up higher compared to the right. This shows that the right hip, gluteus maximus, gluteus medius weakness, which one of the reason, the cause of unable to help him with the movement for kicking. Okay, alright. Normally when we test bridging, we test in 2 legs first. Okay. Also, what other things that we can also see during bridging is there any internal rotation of the hip while lifting up? Okay, for him, I think he's okay, except that he can't really lift up higher. Okay, and also if there is any dorsiflexion, compensation in dorsiflexion movement because of difficulties in trying to lift up the buttocks, and also we can see overactivity of the hamstring muscle. Okay, so these are the things that during our testing. Probably I just want to wrap up everything. So we done the first test on scapula, right? So basically it's because of impairment that we're gonna see is because of his having composition and also weakness. Pain is the major things. Okay, for this second case, one is weakness at the VMO and also gluteus maximus or medius, and also these are the limitations that I can find for this particular patient. And from there, I'm going to move from this assessment. Then we can isolate doing things. For example, strengthen the VMO, doing some kinetic movement change for the knee, and then practice the bridging exercises. With that, I hope it's clear. Thank you very much. Thank you.